did get our vaccine. So 5 million have been vaccinated so far. Keep going, more vaccines coming. And we're here today with Magdalena. So congratulations. We were looking at her filler rhinoplasty results, no surgery. How has it done for you so far?
Great.
Very good.
I'm back for more.
Family and friends, they can't figure it out, right?
I haven't noticed, no. Unless
And
they see this video.
even very close family members.
Nope.
Okay, so when it looks natural, it looks good. So let's take a look at her pictures. You can see just from the filler rhinoplasty, she had a lot of prominence there, and we're able to soften that. This is no surgery. That prominence, it's subtle. You want to do it slowly. You don't want to go too far. Now, she doesn't look like, oh my gosh, she's got, her nose is too big. She had the little nasal cleft, which she had another interesting name for it that I'm not going to repeat, but that one you can't see anymore. And of course, we always look our best when we smile, so she's the A+ student looking for extra credit. So you can soften through these areas just with filler, no surgery. And when you look on the lateral view, we're going to strengthen the jawline a little bit, the nasal dorsum rather. We're going to project the nose, and I'm going to also project the base of the columella. The columella is that piece of flesh in between the two nostrils. We talked a little bit about projecting the chin as well. We're not going to do that, but that is a consideration because that does offset the projection of the nose. So for today, we're focusing here. Any questions, Magdalena, about our goals? We drew things out. So right in through this area, we're going to fill a little bit up here, and then I'm going to project the columella some. And if we're happy with what we see today, great. And if we want to add more, we can always build. So this way, we're not going too far. I'm going to use the Hiba cleanse for the physicians and students that are watching. Let me have you rest your head all the way back. So filler rhinoplasty is an advanced technique. You do need advanced nasal anatomy and even surgical training. Using the safety cannula certainly makes things much easier and safer to get a good result. And of course, technique and experience. So I love the instant gratification of the filler rhinoplasty. And today I'm going to use a little different approach. A lot of times I'll approach from the bottom, but today, since I'm not injecting anything at the dorsum, the bony dorsum, there's a little bit of a cartilaginous dorsum, I'm going to insert the cannula here and just fill the tip of the nose in this direction to get a little bit of that plumping. And then we're going to come right in through this area, which is a sensitive area. I'm going to numb from below. And then we're going to come from the top. I'm going to start from the top right here on both sides. So let me do a little bit of the numbing medicine. I like to use the buzzer. So let's see, I might need, do we have another one? Because it looks like this battery is dead for this. Can you grab another buzzer for me, please?
Right here?
Yeah, that one needs to be recharged. We got plan B. Charlene's always prepared. I can never catch her unprepared. I'm going to lift your lip here, and you're going to feel buzz, and then you feel, pinch on 3, 1, 2, 3, pinch. You feel small, medium, big there. Not too bad?
Not too bad at all.
So you'll feel a little pressure pinch. I'm not in a hurry if you need a break. How about there? Small, medium, big?
Small.
Little pinch, little pinch. Thank goodness for lidocaine. Try and make it easier than the dentist's office, or easier than getting a tattoo, or easier than getting a tattoo at the dentist's office, but we'll make it easy. How about there? Do you feel pressure, pinch? Not too bad?
Not too bad.
Little pinch?
A little.
So I'm going really slowly. This is only going to take about 30 seconds, right? And even though that does take a little bit of time, if you go slowly and take the full 30 seconds and numb here, patients will really appreciate. Okay, so now I'm just going to hold a little pressure and your nose will feel a little numb and goofy. And the upper lip will feel goofy. So I'm going to use the same insertion point for both sides, just central in the dorsum, buzz and pinch. 1, 2, 3, pinch. Sorry, a little pinch there. You don't need that much. And now, because that numbing medicine will give a little volume to the area, I'm just going to press that down and take that into consideration, obviously, because we're trying to elevate inferior and superior. We're always following the ABCs of plastic surgery. If you know the ABCs of plastic surgery, you will make better decisions. You will get better results, and you'll save money by doing things the right way the first time around. ABCs of plastic surgery, there are 4 areas that we address for the facial appearance. Now, Feeling any lightheaded or anything like that?
No.
Last time she felt a little lightheaded, we just
Yeah.
lay her back in the chair. That's the vasovagal response. This time she drank a lot of water. If she feels lightheaded, we'll lay her back. That's not a problem. Do you feel a little bit numb under here where I'm touching, or not really?
No,
Okay.
it's
Now, how about here? Do you feel a little bit of a pinch? Small, medium, big? Okay. I'm going to go away in just a few moments. So we can always lay people back if they need to. How are you feeling?
good.
ABCs of plastic surgery. A starts for areas. There's 4 areas that we address for the facial appearance. If we sag, we tighten. If we lose volume, we fill. That's what we're doing today, is filling. Sun damage, wrinkles, and sunspots to the skin. We can polish and repair the skin. The 4th area is better than everything else. That's our behavior when we smile. We always look our best. Make a big smile for me. And interestingly, the nose does change. Now relax and smile again. The smile puts a little more tension and actually draws it down. Now do that maneuver that you puff out your lip just a little bit. She wanted to see how that lifts her nose, right? Now relax as best you can. So we're going to do our best to do that with Columella, injecting directly. I tell filler rhinoplasty patients they always have the option if they want to do surgical rhinoplasty later, but most of them are just happy with what we do and don't want to. You feel a little pinch there or not really?
Not really.
And Charlene has everything set up perfectly for me, thank you. And thank you to Alex. Alex is our camera person, our Emmy Award winning camera person. Not really winning an Emmy, but we would give her an Emmy if we had one. I'm going to turn your head a little towards me. So for the physicians and students that are watching, this is a subcutaneous injection. Twist technique, twist, twist, twist. I'm not in a hurry if you need a break. You feel a little pressure pinch there?
Not really.
Little bit of numbing medicine here. Shiver technique, so I inject very tiny amount of filler over a large area. And there's also a little bit of hydrodissection, which will make it easier to pass the cannula with subsequent attempts. So, placement of the cannula, twist, twist, twist. How about here, any pinching? So now that I've injected some of the product, it's going to be very hard for her to feel what I'm doing. Now I can feel my cannula right near the tip. Little pressure pinch there.
A little.
I'm not in a hurry. If you need a break, you let me know. It's looking good. Very good. You doing all right?
Yeah.
If you need to lay back, it does not bother what I'm doing, okay? How are you feeling?
Good.
No lightheaded or anything like that? Little tiny bit. Let me do this. Let me go ahead. I'm going to lay her back just because that'll give me some control and I want her to feel comfortable. Can you get the little drape for me? Thank you very much. So I'm going to raise her feet up. That's a normal vasovagal response. And we're just going to put a little drape over top.
I feel more relaxed when you're laying.
Yeah, of course. How's that? Is that okay like that?
Yeah.
So I'm going to raise her up high. Okay, very good. So I've already put about 1/2 of a cc. Twist, twist, twist. The tip of the nose is defined by the lower lateral cartilages. You can look that up on Google. But don't try this at home. Little pinch there or not really?
A little.
So now I can feel myself. The tip is right in the intracrural space. Little pinch there or not really?
Not really.
Okay, good. If you need a break, you let me know. Everything's looking really good.
I'm good now.
Dr. Rich, Miriam is asking, do you use fillers for the under eyes?
I absolutely do. In fact, if you look at Magdalena's pictures, you can see under her eyes, she actually got a really nice improvement, because the last time we said, let's use the rest for under the eyes. We didn't use the full syringe in her nose, and under the eyes was a really, really nice improvement for her. I'm very happy with that. So now what I'm going to do, now that we've injected across through the... How are you feeling, Magdalena? Doing okay?
Yeah.
The nose does have some memory, so you can't take away features 100%. So I like what I see there. I'm going to do a little bit superiorly now as well. I'm going to come from this side, Alex. If you want to come to the other side so you can see me better. Thank you. Pressure pinch, pressure pinch, pressure pinch. About 1/10 of a cc to 1/2 of a tenth of a cc with each pass that I make. Little pinch there, not too bad.
Not too bad at all.
Let me set this down, and I'm just going to do a little bit of a massage. So I can see from the side the straightness that we're getting in the dorsum. It's the bony cartilaginous dorsum that you see that projection. Everything's looking good. Twist, twist, twist to precisely position the cannula. And then this is the just below the glabella, right at the nasal radix or the root of the nose.
Dr. Rich, Eve says hi. What is the downtime?
There is no physical downtime. Did you have any bruising the last time we did it?
Very lightly, a little concealer right up. That lasted maybe like 2 days.
Okay. Do you feel a little bit of a pinch right here, little pinch?
A little, barely anything.
So what I'm going to do now is I'm going to come from below. I'm going to come from the top. Can you see from this side here? Maybe from this end. So where I am here, I'm lifting up the columella so I can access it. Twist, twist, twist. This is subcutaneous. You feel a little pinch there?
Feels nothing.
She says she feels nothing. I don't feel anything either. Pressure pinch, pressure pinch. And I'm guiding that cannula by redirecting her tissues. Put a little bit of filler in. Sorry, I'm blocking your nose. If you feel I'm blocking your breathing, you let me know. Just do a little mouth breathing for a moment. So I can see him right at the tip. The nose does have a memory, so you know, we're back to do a third session of a little here, a little there, and in these types of approaches, it's far superior to having a big dramatic procedure, which even if you do a nasal surgery, you have to commit to doing 2 or 3 nasal surgeries because sometimes that needs touch-up. You need a filler touch-up, very easy to do. So this is certainly a desirable way to go. Little pinch there or not really?
Nothing.
Okay, so I've got a little bit of filler left, and I'm just going to do some little molding and sculpting here. Afterwards, I tell patients for the filler rhinoplasty, I do not want them to massage. So I'm going to sit you up nice and easily. Pardon me here. I'm going to bring you down to earth. We'll hold this for you. Thank you. So let me show you what I've done so far. How are you feeling? You okay?
I'm good.
Okay, hold this for me. So what I've done is I built up in here, and there's a little swelling from me adding in here, and then I added some to the top. I'm going to add a little bit more here. How does it look so far?
It looks really good.
Yeah, it looks natural,
yeah.
not overdone. Make a big smile for me, big smile, big smile, big smile. So now I'm just going to add a little deep to see if I can give her a little bit more projection. So we're on track. I'm going to add a little more, okay? I want to make sure you're happy.
Yeah.
Very good. Now rest your head back, and then, are you feeling any lightheaded at all?
No.
I'm going
not
to try it in
anymore.
this
I'm good.
position, but it's easy for me to lay you back
No,
if you
I'm
need me
good.
to. So now through the same insertion point, I'm just going to try and build up at the base of the columella. We'll call it the anterior nasal spine. I'm just going to lift up just a little bit there. You feel a little pressure pinch?
A little.
Now, ultimately, I'm going to want to see her at 6 to 8 weeks to take some more pictures
Okay.
and reevaluate. Little pinch there, not too bad.
Nothing. Numbing.
Thank goodness for lidocaine.
Oh yeah.
Building up near the nasal spine to try and project. The soft tissue. You can project the soft tissue envelope. It does help a little bit. You can even see just elevating the soft tissue. Notice the effect. You see it lifts a little bit. If we can get another millimeter or half millimeter, that's a good thing. Everything's looking good. I can feel right the internasal spine, which is the midline structure on the base of the nose. Little pinch there, not really. How are you feeling?
Good.
Any lightheaded?
No.
How's your breathing through your nose?
Perfect.
Good. It's interesting, when you numb around the nose, some people feel like they have a tough time breathing because when you breathe in, you feel the air coming through. When you're numb, you breathe in and it doesn't feel like you're moving air through your nose. So sometimes people will feel, I can't breathe through my nose when they're breathing perfectly normal when they've been numbed. Okay, so let's take a look here. So I put a little bit more in the base,
Okay.
so a little more strengthening. How does it look so far?
Perfect.
A little bit of swelling. We don't want to taste the chocolate cake before it's done baking.
Yeah.
So here's her before pictures where you can see, let's see, let me put it on this, I'll come on this side if you can look on that side over there. So where she had a lot of that projection. We've been able to straighten that out quite a bit, and then she is the A+ student looking for extra credit. She certainly doesn't have that type of prominence where she used to, and this is all non-surgical, and she always looks so good when we smile. There's the smiling picture. It'll feel goofy with the numbing medicine, so, and no more projection of that, the nasal hump, that's bone and cartilage. So 6 to 8 weeks, we'll check in.
Okay.
I'll give you the hugs from here.
Yes, yeah, hug.
We'll do things the right way. We're here to help you raise your standards for cosmetic treatments. I'm Dr. Rich Castellano. Remember the ABCs of plastic surgery? Get your vaccine. It's out there. There's limited supply, but they've had 5 million vaccinated so far, so we're going to beat this pandemic. We'll see you in the next video. Congratulations.